This is why I stopped doing PDO thread lifts. I'm Dr. Monica Kieu, facial plastic surgeon, and PDO threads were designed to fill a gap between fillers and facelifts. I understand the appeal of them because they were marketed as an alternative to facelifts because they can lift the face, and that sounds really appealing, especially when associated with 0 to no downtime. But we found in reality, they're just not living up to those claims. In terms of marketing, they were a bit oversold, and what we saw in real clinical experience is that the results are really subtle. So what you would see with these thread lifts is a really temporary lift, and a lot of times I believe it was just due to the swelling. And then over the next few weeks to months, patients will go back to their baseline, and then they're out thousands of dollars because these thread lifts are very expensive. And then often I would see complications from these procedures, for example, lumps, bumps, scar tissue formation, nodules on the skin. All of these were really difficult to treat, and sometimes I would have to remove the threads completely. This is things that I've seen firsthand, both in my own patients and other practitioners' patients. So what do I recommend instead? For those of you who want lift right here on the upper face, an endoscopic brow lift or a temporal endoscopic mid-facelift is a great alternative. Not everyone is going to be a good candidate, but these results are much longer lasting and much safer. For a lift in the lower face, obviously a facelift and a neck lift is a gold standard, but I know this isn't a reality for everyone. You can consider some sculpting or supporting filler here to give you a more defined jawline, and this might help give the illusion of some tighter skin. Also, energy-based devices, RF microneedling or lasers, ThermiTite, these all can bridge the gap between non-surgical and surgical. If you want to talk more about it, feel free to give our office a call.